Good afternoon, everybody. Welcome to the Focal Points podcast. Today we have a special guest, Nathan Jones. He's the CEO of XLEAR. You've probably seen the nasal sprays at CVS and many stores, and just how effective they actually were for me. Myself, I was sick last week, and absolutely great stuff, and a really great guy. He's also a very smart guy. So, Nathan, thank you so much for coming on the show. And just tell us a little bit more about yourself. And we're going to dig into how fluoride became a public health religion for like the past 70 years.
Well, my name, as you said, is Nathan Jones. I started the XLEAR company in 2000. So we've been around for about 25 years, a little over 25 years now, based on a nasal spray that my dad, who was a physician, he started using it on babies to wash bacteria out of their nose, bacteria that were causing ear infections. And we've been selling it since then. And, you know, it's a nasal hygiene product. It's not a drug. It's not a pharmaceutical. It's the whole idea. And the concept is we wash our hands, we brush our teeth. Most bacteria, most pathogens, most viruses, they enter through our nose. So logic would just tell us that if we can wash our nose without damaging the commensal microbiome in our nose, that we probably should be doing that, and we would be healthier. And there's a number of studies out there showing exactly that, as much as sometimes our government doesn't want to agree with the science.
Right. Well, yeah. I mean, those products. I was so sick. I had so much nasal discharge, but I just had clogged sinuses, and I used the XLEAR spray, the one with oregano in it. I mean, the symptoms improved fast, like really fast. So really great stuff. So let's get into what's happening with fluoride. Why has that appeared to have been the only thing being promoted to improve oral health and prevent cavities, basically, from our agencies for the past many decades? Why is that the case, and why is it wrong?
I'm not going to say that it's wrong, but I would say that focusing on that and ignoring all of the other options is wrong, and it's immoral. I'm going to tell you it's immoral. So the story behind fluoride is, it goes back for over 100 years. But there was a small town in Colorado, it wasn't Telluride, but one of these small mountain towns where people's teeth were turning brown, but they weren't getting any cavities. And so they sent some people up there. And what they realized is that fluoride helps to remineralize the enamel in the teeth into what's called your teeth are made of hydroxyapatite, and fluoride remineralizes them into fluorapatite, which is stronger than hydroxyapatite. And so having a stronger enamel is a bonus. Okay. And so they started, and the ADA, the American Dental Association, was adamantly opposed to the use of fluoride because they said, and this is up until the 1940s, 1950 is when they got fully on board with xylitol. But prior to that, the ADA, the American Dental Association, was adamantly opposed to fluoride. And what they said is, if you use fluoride, you're going to have to use a toxic amount to see any real benefit from it. And what happened that changed the ADA as a group's mind, and I'm not saying this on behalf of the ADA, this is what I'm saying from the outside looking in, because it's the only thing I could find, is that in 1945, the NIH did a study in Grand Rapids, Michigan, where they put 1 part per million fluoride in the water. And within a couple of years, they were coming back and saying, oh, we're reducing tooth decay by 50-60% just by putting fluoride in the water. We're not talking to them about brushing their teeth. We're not talking to them about eating less sugar. All we did was put 1 part per million fluoride in the water, reduce tooth decay by 60%. Okay. The problem with that is it sounds all good and great, but nobody has ever been able to reproduce that study. Okay. If you just go do a Google search and type in and say, what is the accepted reduction in tooth decay for using fluoride? In fluoride in water, toothpaste, mouthwash, or varnishes, pills, all of the different aspects of fluoride. And the accepted reduction is 20 to 30%. which doesn't seem like that much for something that is that has the potential to be incredibly toxic to us. But in 1950, the ADA endorsed fluoride based off of the data that came out of this study in Grand Rapids, and they've never looked back. They've never gone back and said, why is it that they got over a 60% reduction here, but today we accept it at 20 to 30%. And last year, the Cochrane Group, which does meta-analysis, and maybe I should have you explain what a meta-analysis is. You want to explain that?
Yeah, so it's basically so they collect all of the studies that measured a certain outcome using, and they have to usually have the same type of measure that they derive. They take all of the studies, they combine all of the population sizes. So say it's 10 studies, each study has 100,000. You'll have like a million sample size then in this one meta-analysis. And so it's basically a summary of all the previous papers that looked at the same thing. And so they are obviously very, very powerful in their implications because you can't really get stronger than that.
And that's correct. And what happened was the Cochrane Group, which is the most respected group for doing these meta-analysis, okay, they came out with a paper where they actually said at best it was probably a 4% reduction in tooth decay by using fluoride. And at 4%, there's no way that the benefit outweighs the risk. And you have dental professionals who say, but I see it in my practice. Well, they see a lot of it is because they think they're seeing it. In Utah, they took the fluoride out of the water. And the crazy part of it is the only place in Utah where they had fluoride in the water was actually Salt Lake County. It's the one county in the state. I think maybe a little bit further north they also had it, but a lot of places don't have it. But we get fluoride. People get fluoride from so many different places that the problem with putting it in the water is that no one can accurately track how much fluoride you're getting. You put fluoride in your toothpaste, how much fluoride are you actually getting into your body? You don't know, because you don't know how much of that toothpaste you're swallowing, especially when you're giving it to a young child. Okay? You put fluoride in the water and the little kids are drinking it. On a hot summer day, they might drink 5 times more water than they do in the winter. So there's no way that you know, and there's no way to track and be able to know how much fluoride these people are getting.
So it's like it's medicating the population with uncontrolled dosages of this of fluoride. And so now one thing I read, and you tell me if it is important at all or not, but regardless, it's disturbing. What forms of fluoride are they adding to the public water supply? I heard hydrofluorosilicic acid. I mean, is there some industrial byproducts? Does it like?
I read up on that a while ago, and I can't speak intelligently about it today. I read up on it a while ago, and it is a different type. It's not a naturally occurring form, where they were adding it and they saw the benefits in Colorado. That was actually a naturally forming or a natural occurring form of fluoride. I don't know enough about what they're putting in the water to speak intelligently about it.
Okay. Well, regardless, I'll always remember this. There was a news story. The fluoride at the water plant spilled out and it burned through concrete. So I'm like, man.
That actually happened here in Utah.
Yeah, it's like, man, I don't want to be ingesting something that can burn through fluoride in high concentration.
They actually had to go door to door all around and everybody in this water district and tell them to turn on their taps and just drain it and not drink the water.
Oh, man.
So I want to say that was back in 2021, but they just put in the wrong amount of fluoride in the water. So, but anyways, and I want to be clear. I'm not here saying that all aspects of fluoride are bad and wrong. But what I am saying is that people should be allowed to choose what they want to use. And they should be allowed to know about what the different benefits of fluoride are, you know, what the risks are. You know, if you want to use, so let me explain the problem that I have with the fluoride religion. And that is that the American Dental Association in 1950, they endorsed fluoride. Since then, the ADA and the FDA have never, ever endorsed, allowed any other product to be put on the market that can help, that can make the claim on the package, helps to reduce tooth decay if it does not have fluoride. Okay?
No other product.
None. Try to find one. Okay? That you can, that is on the market and can put the claim on it, helps to reduce tooth decay. Okay? Or prevents tooth decay. Because
So
there are.
Why are they doing that?
I don't know. That's a good question, because the fluoride industry is not a huge, I mean, it's not like a $100 billion industry. But the crazy part of it is that think of how much money has been spent in our research institutions since 1950, trying to find ways to prevent tooth decay. And so either the ADA and the FDA are saying that all of that money was wasted because we can't find a product, or they're just saying it's not worth us letting the people know about it, because the people can go and read the studies if they want to go in and dig into it. But the companies that actually have a financial interest in educating the public about a better product, we can't do that. We're banned from saying what xylitol does. We can't go put on our tube of toothpaste, xylitol prevents tooth decay.
But so tell us, what does the data, testing, or studies show on xylitol or any of these other compounds regarding tooth decay? Do they show, like, any data? Does it show it does prevent it?
Of course. Thousands of studies show it.
So thousands of studies.
And the logic behind it is just as reasonable. Okay. And I told you this before we got started, but the whole idea of dentists and the field of dentistry being so dogmatic and wholly focused on fluoride is the perfect example of how our healthcare system treats the symptom, not the disease. The disease that causes tooth decay, and we've known this since 1924, so 101 years ago, we knew that tooth decay is caused by a bacterial infection of strep mutans in our mouth. That strep mutans bacteria eats 6 carbon sugars, sucrose, glucose, fructose, and even sorbitol, mannitol, maltitol. It breaks those sugars down, and the byproduct of that is acid. That acid is what creates the cavities. Okay? Those bacteria, the strep mutans bacteria, cannot metabolize xylitol. It looks like a food to them, and so they eat it. And in the long run, in just a couple of months, you're going to change the whole microbiome of your mouth away from the strep mutans bacteria to bacteria that are more commensals, that are more healthy for you. And there's studies showing this, studies going back decades.
So what does fluoride do in contrast? It doesn't kill the big.
Fluoride has a negligible effect on the bacteria. Okay, they're trying to make the case that stannous fluoride does something, but if it really did, you really wouldn't have a bacterial infection anymore, and we continue to have it. Because despite 75 years of fluoride being shoved down our throat, over 90% of Americans still have cavities. You know, having that medication forced on us, we still are being sick. So obviously it's ineffective.
Right,
but
right.
What fluoride does is your enamel in your teeth, it makes your enamel more resistant to the acid. But you can also use hydroxyapatite, which studies show it's about as effective as fluoride. You can also use sodium or calcium trimetaphosphate, which the studies and the data show works better than either fluoride or hydroxyapatite.
And that's what I always thought. I'm like, you know, why not just use these other minerals, right? Why does it have to be fluoride? That's what I never would understand.
I don't understand, and I can't answer that question. Because I talk to dentists about it, and they're like, we got fluoride. We don't need anything but fluoride.
Well, xylitol, right? It's naturally produced in the body, right? And it's found naturally in plants.
It's
So
one of the most common sugars on the planet. I mean, xylose, which is where xylitol comes from, is the xylan that makes up cell walls in plants. Okay, it's all about those sugars. And you can get into it. Our body makes it because it's part of our defense mechanism. I know this is, hopefully nobody's eating lunch right now. I know this is over lunchtime some places, but what our body does with those sugars is in our snot, in our mucus, all along our gut, we have these things called mucins and glycans, which are all sugar molecules. And the way bacteria and viruses adhere to our tissue is by sugar molecules. Okay, I use this as an example, but the spike protein, it's not the protein that actually attaches to the tissue. It's actually the what's the term? It's glycosylate. No, I can't remember the word. The glycocalyx. It's the glycocalyx that surrounds that spike protein, which is made of sugar molecules, and it's the sugar molecules that actually attach to tissue. And if you flood, that's the way that xylitol works in a nasal spray. It's the way erythritol works. You can use xylitol in a nasal spray, erythritol. You can even use other sugars that we have shown in multiple studies block bacteria and viral adhesion in the upper airway. But anyway,
xylitol does so much, right? It even prevents viral attachment, right? Not just bacterial.
Yeah, but I mean, it's because evolutionary. If you look back, if you go back to before we were actually refining all of the sugars that we eat now and adding them to our food supply, most of the sugars that we ate we ate a substantial amount of 4 and 5 carbon sugars. And we ate a lot less of the 6 carbon sugars.
So explain to our audience what's important about the 5 versus 6 carbon sugars.
Because a lot of the pathogens that harm us cannot metabolize those 5 carbon sugars. And most of the commensals, and there's studies out there in the medical literature and the dental literature showing that most of the commensals that we want in our gut, that we want in our mouth, that we want in our upper airway, the 5 carbon and the 4 carbon sugars actually pushes that microbiome toward a healthier commensal microbiome.
So it improves the microbiome, right? It's not like it's going in and killing everything off, right? Unlike, right, some of these other so what products are killing everything off that people are frequently using? Because I know people will be interested in that.
So there's a number of studies out there showing that if you're using a mouthwash that kills 99.9% of all the bacteria, your chance of having a heart attack go up. Because in your mouth and in your upper airway, you have bacteria that help create nitric oxide. And if you're killing all that, well, then you're not getting all the nitric oxide. They have other ones where if you're using like chlorhexidine a lot, which kills everything, and one of the things you can look at is look at our society. The bacteria that help us digest gluten and the bacteria that help us digest milk typically live in our mouth. And so if we're going to sit here and nuke it all the time with mouthwash that kills 99.9% of the bacteria, you could expect to see an increase in gluten intolerance and lactose intolerance in our society.
Wow.
Which is exactly what we've seen.
So that could explain why we see
I'm not going to say it explains it. I'm saying it's a part of it.
Right.
Human beings are such complex organisms that I don't want to say that any one thing is cause of everything. I mean, there was a paper that came out last month where they talked about how Parkinson's disease is caused by the strep mutans bacteria that causes tooth decay. And, I read the paper. It was very interesting. And I agree that it probably could play a large part in it, but I'm not going to say that it's the causative agent. I think there's many factors in there.
Right.
But still, that's another point as to why oral hygiene, why making sure your kids and us as adults, why we brush our teeth, why we should be using mouthwashes, proper oral hygiene that works to facilitate a commensal microbiome rather than one that is trying to kill everything off. And the same thing with our upper airway, because there are so many systemic illnesses that have their roots and that are tied into oral health.
Yeah, for sure. And we know oral health is so important. We know it's systemic. It has systemic consequences.
Very
so
much.
yeah, it's so important to know for sure. And so, well, tell us what you're doing specifically with regards to the FDA and actually, physically, making a difference in this area where, since fluoride still is the dominant, it's the only thing that you can make claims it's preventing cavities. Tell us, what are you doing to kind of help change that?
Well, one of the things that we did is last month in October, we actually filed a petition with the FDA to allow companies, not just XLEAR, not just my company, but to allow companies that make products with xylitol, gum, mints, candy, mouthwash, toothpaste, to be able to make claims that it helps prevent tooth decay or prevents tooth decay, the same claims that you would make for fluoride, for people that make products with xylitol, so that we can actually go out and educate the public about the benefits of utilizing xylitol and getting rid of that and treating tooth decay like the bacterial infection that it is.
So that's,
and we have the American Dental Hygiene Association has joined us on that.
wow. So this is huge. And what do you predict will be the FDA's response? Because I know this will be so important, not just for companies that utilize xylitol, but for the consumers that will actually be able to understand, wow, this actually, will prevent cavities. I don't have to only go look at the, find the fluoride products that say they'll help. Because I know, a lot of people, they don't know about this, so they just will read what's on the package, right? So this will help not only the consumer health, but the companies as well.
What I think it will do, and what I hope it will do, is I hope that the FDA approves it. We may have to have some back and forth on what has to be in it to make the claim. But I actually would very much think that the FDA, looking for the best interests of the public, of the American public, that the FDA, they kind of, I don't want to say they have to, because I'm not here to tell the FDA what they have to do, but they kind of really should, because you've got studies showing and reason explaining how it actually treats the bacterial infection, how it actually removes and gets rid of the strep mutans infection. And that's much more effective than fluoride at treating the bacterial infection. So you can't say, well, we're going to allow fluoride, which reduces tooth decay by 4%, but we're not going to allow anything for xylitol, which we know reduces tooth decay by 80+%. We know it reduces preterm burst by 25%. We know that if mothers chew and use xylitol gum when they're pregnant, their kids don't get tooth decay. We know that if you use it in schools, that kids chew it for a couple of months in schools, and even 8 years later, they're still not getting tooth decay. We know that if pregnant mothers chew, if the government funded women on Medicaid that are having babies, which almost half of the babies in the United States today are born on Medicaid, but if the government even put $17 million to supplying those women with xylitol gum, not buying it necessarily from us, just buying it from anybody that wants to make it, we've already committed that anything we sell to the government, we won't make any money on. We'll just give it to the government, because we're not giving it to them, we're selling it to them. Because we think it's that important of a public health measure, because most of the time you're dealing with small children. And, I want to stay in business, but I don't think it's right to try to make a huge profit off of keeping young children and babies healthy. But the studies show that if pregnant mothers chew xylitol gum, you can pay, it'd cost $17 million to provide them all with the xylitol they need. They get rid of the bacteria out of their mouth. They don't have it to give to their children. And what they estimate is that our federal government will save $14 billion on downstream associated healthcare costs. So it's a simple concept. I mean, you're getting over 1,000% return on your investment, which is why I don't think the government will do it, because it makes too much sense.
Yeah, exactly. It makes far too much sense.
But people, the individuals, should be able to understand. They should be, we should be allowed to discuss published studies showing that data with the public, without the FDA coming in saying, "Hey, you can't share that data because that's a drug claim."
Right, because fluoride, it is in a sense an ideology, a religion among our agencies. Because what? So it's been has it been 70 years or what, a century? So it's been a century of just
years.
Man, so it's been that long of just ignoring everything else. So imagine how much healthier of a population we could have had if they weren't so hyper focused on giving everybody fluoride.
It's insane. It's insanely crazy. And another point that you can make is that in 2000, the Surgeon General put out like a 350-page report pointing out that the oral health of America was declining. Okay, 25 years ago, it was already declining, and it has. Okay, we have more tooth decay today than we had in the 80s and 90s. Okay, it's treated better. And so we don't have as much untreated tooth decay, but we still have more cavities happening. And there's a wide number of reasons for that. I mean, there's so much sugar in our diet that I think that one of the very things that Kennedy and his team, I know there's a million things that they need to do. But somebody should start telling and having some of these companies not just pull out the dyes, but get the sugar out of their food. We don't need that much sugar. There's other things that they can use, but I mean, the sugar is just, it really is toxic.
Yeah.
It really does feed a lot of pathogens in our body. But now I forgot what I was going to say. But one of the things that they need to do is they need to talk about sugar. They need to get people educated about how to prevent tooth decay and push. I'm trying to think. I had a train of thought there, and then I lost it. You got to refresh my mind there.
Well, I'll tell you, just in general, this is important, right? This is very important, and I haven't heard much mention so far of the current administration on oral health. It might have been in the Maha report. I don't really remember, but.
Well, let me go back to that, because that is where I was going with it. Now that you reminded me, you didn't even know it. Even in the Maha report, one of the things that Kennedy did when he came in, and I 100% agree with this, was he got rid of the dental division at the CDC. And the reason why I agree with that is because even though the Surgeon General 25 years ago wrote a report and said something needs to be done because you cannot possibly have a healthy population if their mouth isn't healthy, because so many systemic illnesses come through inflammation in our mouth. Nobody did anything. In 2021 or 2022, the head of the NIH, the Surgeon General Vivek Murthy, and the head of the NIH, Francis Collins, and a dentist, Souza, S-O-U-Z-A, I think, they actually wrote a follow-up report. Again, pointing out exactly the same thing they pointed out 21 years earlier, and again pointing out we're not doing anything. It's like, we know this is an epidemic. It's the longest running epidemic in our country's history. Okay, more people have tooth decay than ever got COVID.
And it's harming them, right? So tell us, what harms is it causing? It's causing heart attacks, right? Is it causing strokes? Is it causing neurodegeneration?
I mean, if you really want to get a good list of it, if you go to the American Academy of Oral Systemic Health, it's called AOSH, but it's AAOSH.com. And it's an organization of doctors and dentists and hygienists and nurses, and they're trying to get dentists and doctors talking to each other more. And, you know, it's an organization that we fully support their mission, and we try to help them as much as we can because we do think it's important. But I want to say there's 15 or 20 pretty bad systemic issues. Alzheimer's, there's a connection between Alzheimer's and bad oral hygiene, obesity, diabetes, Parkinson's. I mean, the list is, I would say go to AAOSH.com and read the list, and they'll have some of the studies and some links to some of those studies. But all of that comes back to we need dentists working in public health that are actually going to go out and talk about something other than fluoride. And the CDC has known, again, this is an ongoing epidemic. It's been going on for at least 25 to 70 years, and the CDC hasn't done anything about it. So fire the people that are being incompetent and can't do it. I 100% agree with that. But you need to get some people in that actually know and understand that tooth decay is a bacterial infection, that are willing to work in public health to help change the programs they have, where they're teaching people how to treat tooth decay like the bacterial infection it is, so that we can end this epidemic.
Yeah, they got to do that. They got to install people that know all that and can make direct actions with direct recommendations on that. Because yeah, this is very serious, and it's been plaguing us for so long.
And if anybody has any connections to those guys, tell them to call me. I have a whole list of doctors, dentists, and physicians and dental hygienists that would jump at the chance to be able to help.
Definitely. So yeah, anybody's watching for sure. He knows people, and people would love to help, and it's got to happen. But do you have anything else you want to tell our audience today? Any closing remarks on all of this? I know. So we went through so many things regarding oral health. We went through fluoride. We went through xylitol. We went through the policy actions. What's remaining?
Sodium and calcium trimetaphosphate. I mean, that there are options. There's a lot of options out there. Dental probiotics. They have dental probiotics. I mean, if your listeners really want to see what the difference is, one of the things that I would highly recommend is you can go online and buy a test kit. And I'm trying to remember the name. We have one right here in Utah that I used, but they send you out a kit and you just spit into it and then you mail it off to them. And they'll actually send you back a genome of the bacteria in your mouth and tell you whether they're friendly, whether they're bad, whatever. And then take that and then start using xylitol and use xylitol aggressively for 2 or 3 months, and then do that test again. And you'll see how the microbiome in your mouth changes from pathogenic bacteria to commensal bacteria that you need and that help you.
Definitely. So you hear that, everybody? You can go check out your microbiome in your mouth, try out some xylitol, and see the difference for yourself there.
They'll even send you. Let me pull this up on my phone. It's mine, so it's it's HIPAA, whatever you want to call it.
Compliant.
Yeah, it's mine. So I just got to make sure it's mine and not my kids that I share with you.
All right. We're gonna see Nathan's microbiome in his mouth.
Yes, and this is the form that they send it to you in. If I can find it here. Here's pictures. Wait, where is it? Come on. When did I do this? Was it that long ago? Well, maybe I can't find it. I thought it was. Did I delete it? I can't have deleted it.
Well, while you're looking,
there it is.
You got it?
Yeah, I got it. Nope, that's my daughter. That's my daughter. Okay, this one's mine. But so the company's name is called Simply Test.
Yeah.
And they just send you a thing, and it shows you, like, here's all the green bacteria, here's the red bacteria. Like, see, it tells me I have a higher level of Treponema denticola. And so I've started changing some things that I do that address that one specifically. But the bacteria that causes tooth decay, which is right down here at the bottom, I have 0. Okay, that's the one that causes tooth decay. Carries.
Here, bring it closer to the camera. Bring it closer.
I'm trying to make it so that you can actually see this. Right here, these two right here, caries risk, no. Whatever those are, Streptococcus mutans and Streptococcus sanguines. With Streptococcus sanguines you want, and but you can go get that done. It's like, I don't want to quote it because we actually buy a lot of them for a lot of the research projects we do, so I probably get a better deal, but it's probably $50-$100 in there. And to be able to see and know that you have a product that's working, it might be worth it.
Right. So you have 0 of that bacteria. So do you also have 0 tooth decay?
Well, I haven't had a cavity in 20 years. My kids haven't ever had a cavity. My oldest daughter had 2 or 3 cavities in her baby teeth, but I started her on some dental probiotics. And you know how they give candy everywhere. They give it to them at school. They give it to them at gym. They give it to them at dance class. They give it to them. You can't get out of it.
Yeah, definitely. Well, Nathan, anything else you want to tell our audience before we close out today? Any important remarks or upcoming developments?
Reach out to your senators and your congressmen. Ask them to encourage the FDA to allow other products to be able to make claims how they have, I don't want them to be able to make claims for things that there isn't any studies for, that you don't have logic and reasoning for. But companies should be able to make a claim for something we know works, and that you've got 50 years worth of data behind it, and that logic, you can sit there and say, yeah, that's why it works. But the bigger thing is go and read some of the studies. I encourage people to go and read studies. We put a lot of studies on our webpage. We encourage people to go and read those studies so that they understand why it is important to use good oral hygiene products, good nasal hygiene products. Because again, right here is where the vast majority of pathogens, the vast majority of times you get sick, it all starts right here. And if you want to save money, if you want to, stick it to big pharma, just don't get sick. Okay? Don't get sick.
Don't get sick. You heard him. Do not get sick. We don't want big pharma's help. Their help has cost us. It's cost us our health. It's cost us lives. It's cost us lots of stuff.
Trillions.
Yeah.
Yes.
Yep. Trillions. All right, Nathan. Well, thank you so much for coming on, and the take-home messages. We have to return to common sense in public health, particularly dental public health, because there has been no common sense for decades.
And I think public health, my personal opinion is, I think that public health agencies should not be staffed with physicians. And I think that they should be banned from discussing pharmaceuticals. And the reason why is because public health should be based on nutrition, which doctors are not educated on. It should be based on hygiene, personal hygiene, which doctors are not educated on. It should be based on public sanitation. Again, doctors are not educated on this. And it should be based on nutrition. Did I already say that? Exercise.
Nutrition, but nutrition is important. That's for sure. That's the key one.
But those are the 4 things that great public health policy should be based on. And none of those are what physicians are educated about. Physicians are educated on how to help people after they're sick. And yes, it's not a black line. It's a very gray area where you go from public health to sick care, from health care to sick care.
Right. Right.
So,
Exactly. Exactly. So
and
we need a
great
revamping.
great doctors actually push that over and they understand that and they're talking nutrition. They're talking, but they've had to go and learn all of that after they get out of medical school.
Right. Right. Yeah, they're not taught it. They're not taught it. So that's another thing that should probably change as well, right? They should be being taught all this stuff so they can integrate all the domains. 'Cause that's
Correct.
so important. Yeah. But all right, Nathan, thank you so much for coming on the show today.
Okay. Thank you.